I am Joy and you are watching my YouTube channel Universal Joy. In this video we'll be talking about the remaining portions of the hip bone, that is ischium and pubis. So we'll be learning about the ischium and pubis, but before moving into the video, if you are new to this channel, then your first task is going to be to get yourself subscribed to our channel and also hit that bell icon below as well, so that you don't miss any single updates of our channel. Now without much further ado, let's just get into the depth of our today's lecture. Now in this lecture we'll be talking about the presenting parts of both ischium and pubis and the muscles attachments, the relations of both ischium and pubis. So let us just start our lecture with the ischium bone. So this ischium bone is the intervening bone between the ilium and pubis, and this ischium bone, it is endowed with three surfaces and three different borders. So basically this border, which you can appreciate over here, this is known as posterior border, and it is continuous with the posterior border of the ilium above. Okay, and this posterior border is marked by ischial spine. Okay, and then this is the anterior border which forms the posterior margin of the obturator foramen, and then this is the lateral border. So lateral border is nothing but the lateral margin of the ischial tuberosity. Now the question may arise, what is ischial tuberosity? Ischial tuberosity is the roughened structure, roughened area situated at the lower end of the entire ischium bone. So basically this ischium, it carries two ends, the upper end and the lower end. So the lower end is represented by the presence of this ischial tuberosity. Okay, now the three surfaces that it has got will be including from the pelvic surface, so which it is called pelvic surface because it is directed towards the pelvic cavity. Now dorsally we'll be able to get to see the dorsal surface. So basically this is the dorsal surface which is adjacent to the acetabular cavity and ischial spine, and then below there is femoral surface which is again directed dorsally, but it can be well defined because it is situated in between the anterior border of the ischium and the lateral border of the ischium, and this femoral surface, it is going to be separating the obturator foramen from the ischial tuberosity. Okay, so what we have learned up to now, I'm going to be again reiterating for your betterment. This is the pelvic surface which is directed which is directed towards the pelvic cavity. This is the dorsal surface directed dorsally. Femoral surface, this is called femoral surface. This femoral surface, it is situated between the anterior border and the lateral border of the ischium, and this femoral surface, it is well defined, and it's going to be separating the obturator foramen from the ischial tuberosity, and this ischial tuberosity is going to represent the lower margin or lower end of the ischium. Okay, this is the these are the parts of the ischium. Now this is actually pubis. This pubis has got one body, two rami, one pubic crest, and lateral to it there will be pubic tubercle. Now this body, it has got three different surfaces. One of them is pelvic surface, or you can call it to be inner surface because it is directed innerly. You can call it to be also pelvic surface because it is directed to the pelvic cavity, and in opposite of this there is the presence of this external surface, or also called as outer surface. Okay, and this is called as medial surface, directed medially, or you can also call it to be symphyseal surface. Why is it called symphyseal surface? Because it articulates with the symphyseal surface of the other hip bone, making a joint that is known as symphysis pubis, which is a secondary cartilaginous joint and which is present longitudinally in the midline. Okay. Now this pubis bone, it has got two rami. This is the superior rami and the inferior rami. The inferior ramus, basically it is going to combine with the ischium, making a joint, or making istiopubic ramus. Again, this inferior ramus, it is going to be uniting with the ischium, and it will lead to the formation of the istiopubic ramus, or you can also call it to be istiopubic tendon. Okay, then conjoined istiopubic tendon is its exact name actually. And superiorly there is the presence of superior ramus, which is going to be merging with the iliopubic eminence later on. So these are the presenting parts of this pubis bone. Another thing is that superior to the body of the pubis, there is blunt or a sharp type of the border which is known as pubic crest, or you can also compare it with the superior border of the pubis. Lateral to it, there you will find a bony tubercle like structure known as pubic tubercle. So basically this is the pubic tubercle which will provide attachment to various muscles and various ligaments, which will come across a bit later on. Okay, now these are the superficial parts of the ischium and pubis. Now in the ischium we'll be able to appreciate two different foramen. Basically we have already learned in the previous video that this is the great greater sciatic notch, and below the level of this ischial spine there is the presence of lesser sciatic notch. So basically this is the lesser sciatic notch, and this lesser sciatic notch and greater sciatic notch will be converted into foramen, because in the previous video we have talked a lot that from this posterior superior iliac spine and posterior inferior iliac spine there will be the origin of the sacrotuberous ligament which will be running downward longitudinally like in this manner, okay, and from the ischial spine there will be an attachment of the sacrospinous ligament which will be running a little horizontally, and they will cross, and these two ligaments will cross with each other, and they will be converting this greater sciatic notch into greater sciatic foramen and lesser sciatic notch into lesser sciatic foramen. So the moment this greater sciatic notch is converted into greater sciatic foramen, it will provide passage to various structures. That means its content will be including that means it will its content will be that means its content may be asked in the question. Again, this greater sciatic notch, when it will be converted into greater sciatic foramen, it will provide passage to various structures, okay. If I mention precisely this part of the greater sciatic foramen or greater sciatic notch, it will be providing attachment to piriformis muscle. Above the level of this piriformis muscle, it will be providing attachment to superior gluteal vessels and superior gluteal nerve, okay, and below the level of this piriformis muscle there will be 8 different structures which have to be told or which have to be mentioned sequentially in the following manner. From lateral to medial side, it will be sciatic nerve first. From lateral to medial side there will be sciatic nerve, then nerve to quadriceps femoris muscle, then posterior femoral cutaneous nerve, then inferior gluteal nerve, then inferior gluteal vessels, then nerve to obturator internus, then internal pudental vessels and pudental nerve. Again, from lateral to medial side below the level of this piriformis muscle, 8 different structures will be mentioned sequentially, sciatic nerve. Then most laterally there will be sciatic nerve, then nerve to quadriceps femoris muscle, posterior femoral cutaneous nerve, then comes inferior gluteal nerve, inferior gluteal vessels, then nerve to obturator internus, then internal pudental vessels and pudental nerve, okay. And what are the contents of this lesser sciatic foramen? Basically the last 3 contents of the greater sciatic foramen will be the content of the lesser sciatic foramen. That means nerve to obturator internus, internal pudental vessels and pudental nerve. These are the 3 contents of these are the 3 structures which will be the content of this lesser foramen or lesser sciatic foramen. Now let us move a little below the level of this lesser sciatic foramen. This is actually ischial tuberosity. This roughened portion is known as ischial tuberosity, and this ischial tuberosity can be divided into 2 different parts by the presence of a horizontal line. So basically this is the horizontal line, and due to this presence of this horizontal line, it will be dividing the ischial tuberosity into 2 different parts, the upper quadrilateral part and the lower triangular part, okay. The upper quadrilateral part will be a little larger as compared to the lower triangular part. Now this upper quadrilateral part is going to be divided into 2 different subdivisions by the presence of this vertical, or by the presence of this oblique line. So let us just imagine that this is the oblique line, and this oblique line will be dividing the upper quadrilateral part into 2 different halves. One is upper lateral and another one is lower medial. So the upper lateral part will be providing an origin to the or rather I should be saying the upper lateral part will be providing attachment to the semi-membranosus muscle, and lower medial part will be providing attachment to semi-tendinosus muscle and long head of the biceps femoris muscle. And now coming to this triangular portion, again it can be divided into 2 different subdivisions by the presence of a vertical line, and this vertical line will be drawn in such a way that the medial portion of this triangular part will be smaller and the lateral portion of this triangular part will be little larger. So the medial smaller, lower smaller medial portion will be providing attachment to the pad of fat or fibrofatty tissue, and lower lateral larger portion will be providing attachment to the adductor longus muscle, or not longus, actually adductor magnus muscle, okay. And this is about the attachment of the ischial tuberosity. Now coming to this ischial spine. So basically this ischial spine will be related to the pelvic part of the ureter. So basically pelvic part of the ureter will be related to this ischial spine, and at the anteromedial aspect of this ischial spine there will be the attachment of the levator ani muscle and coccygeus muscle. So these are the 2 muscles which will be attached to this ischial spine, okay. And this is the femoral surface. What are the attachments of this femoral surface? Along the anterior border of this femoral surface, it will be providing attachment to the obturator externus muscle, obturator externus muscle. Okay, because it is directed externally, so definitely there has to be external muscle of the obturator, that is known as obturator external muscle. This is the trick to remember this remember this muscles attachment. And then along the lateral margin of this ischial tuberosity, this will be providing attachment to the quadriceps femoris muscle, and it will also be providing attachment to ischiofemoral ligament. So iliofemoral ligament was found out to be originated from this anterior inferior iliac spine, and ischiofemoral ligament will be originating from this lateral margin of this lateral border of this lateral margin of the ischial tuberosity, or you can tell it to be lateral border of the ischium. So basically this is the attachment of the ischium, and now we have to learn about the attachments of this istiopubic ramus. So basically on the out is this istiopubic ramus. It is formed by the combination of the inferior ramus of the pubis and the ischium of the ischium and the lower portion and the ischium bone. Okay, again I'm going to be telling you for your betterment. So this inferior ramus, or rather I should be saying the conjoined istiopubic ramus, it is formed by the union of the inferior ramus and the ischium. Okay, and this istiopubic ramus, it has got one upper border, one lower border, and two surfaces. This is the external surface and this is the internal surface. So basically this internal surface, it can be divided into three different areas because of the presence of two different lines. So basically these are the two different oblique ridges which are going to be separating this inner part of the istiopubic ramus into three halves, the upper half and the lower half. Okay, I'm pointing it with the pen so that it can be visible in your eyes pretty nicely. Okay, this is the upper part which is situated between the upper border and the upper ridge. This is the intermediate part which is situated between the upper oblique ridge and the lower oblique ridge. This is the inferior part which is situated between the inferior border and the lower ridge. Now this upper border providing attachment to the obturator membrane. Now this upper part will be providing attachment to obturator internus muscle, and this upper ridge will be providing attachment to the superficial fascia of the urogenital diaphragm, and this intermediate area will be providing attachment to the urogenital diaphragm, which is composed of sphincter urethrae and transversus perineum profundus muscle, and this lower part will be providing attachment to the inferior fascia of the urogenital diaphragm, which is also known as perineal membrane, and this lower portion, I mean to say the lower area, lower ridge will be providing attachment to the inferior fascia of the urogenital diaphragm, and below the level of that lower area, that lower line, that means the lower area, it will be providing attachment to the superficial fascia, it will be providing attachment to the transverse perineum superficialis muscle, and also cras penis in case of the male, clitoris in case of the female, and fascia collis and fascia lata. So these are the attachments of the inner surface of the istiopubic ramus, and outerly there will be the attachment of gracilis muscle, then adductor brevis muscle, then non-hamstring group of the adductor magnus muscle, and obturator externus attached to the superior part of this outer surface. Okay, now let us move into the attachments of this pubis bone. Basically anterior to in the pelvic surface of this bony pubis, at the center there will be the attachment of the levator muscle. A bit lateral to that levator muscle there will be the presence of obturator internus muscle, and a bit medial to the levator muscle there will be the presence of puboprosthetic ligament. Okay, puboprosthetic ligament. Okay, then this is the superior border, basically superior ramus. It has got three surfaces and three borders. So superiorly, the sharp border that you can appreciate over here, it is known as pectineal line. So it arises from the posterior inferior aspect of the pubic tubercle, runs laterally, and it merges with the iliopubic eminence. This is called pectineal line. And anteriorly, this anterior border is also known as obturator crest. It starts its journey from the anterior inferior aspect of the pubic tubercle, runs laterally, and it merges with the acetabular cavity. This is the obturator crest. And inferior to all these borders, there is the presence of the inferior border, which is going to be forming the upper margin of the obturator membrane or obturator foramen. Now amongst these three borders, there are going to be three different surfaces. Like for example, between the obturator crest and pectineal line, this surface is known as pectineal surface. Between the between the pectineal border and the inferior border, this surface is known as pelvic surface, and between the inferior border and the obturator crest, this surface is known as inferior surface. Okay, now this outer surface of the bony pelvis is going to be providing attachment, I mean to say there will be a junction. That means this pubic crest and the symphyseal surface of the pubis, this junction will provide an angle and due to this presence of this angle, there will be one muscle attached to this junction or to this angle. That muscle's name is adductor longus muscle. Okay, so adductor longus muscle will be attached to this junction between the pubic crest and the symphyseal surface of the pubis, and then there will be the attachment of the gracilis muscle, the attachment of the adductor brevis muscle, and attachment of the obturator externus muscle on the outer surface of the body of the pubis. Okay, and what are going to be the attachments of this pectineal line of the superior ramus? So this pectineal line can be divided into two different parts. One is lateral part, another one is medial part. So in the lateral part, there will be the attachment of the pectineus muscle, and then fascia covering the pectineus muscle, and ligament of the Cooper. Okay, and pectineal ligament of the Cooper. And in the medial half, there will be the attachments of the inguinal ligament, like lacunar apex, like lacunar inguinal ligament, reflected part of the inguinal ligament, fascia transversalis, and etc. And in the pectineal surface, there will be the attachment of pectineus muscle, of course. And in the obturator crest, there will be the attachment of the one ligament that is called pivofemoral ligament. Okay, in the obturator crest or in the anterior border, there will be the attachment of the pivofemoral ligament. Now this pubic tubercle, it is very important because it is a question which is usually asked in the OSPI exam, that what are the structures which are attached to this, or which are attached to this pubic tubercle. The attachments of the pubic tubercle will include the medial end of the inguinal ligament, reflected part of the inguinal ligament, apex of the lacunar ligament, lateral cuts of the superficial inguinal ring, then cremasteric ascending limb of the U-shaped cremasteric muscle in case of the male. And what are going to be the relations of this pubic tubercle? Basically, in case of the male, that is going to be spermatic cord, and in case of the female, that is going to be round ligament of the uterus. Okay, so basically these are the two structures which will be related to this pubic tubercle. Okay, then this pubic crest, it will be providing attachment. It will be providing attachment to the lateral, the anterior lower portion of the anterior abdominal wall, and the lateral head of the rectus abdominis muscle and pyramidalis muscle. And sometimes you can also call as mention the conjoint tendon or fascia transversalis to be attached to this pubic crest as well. So basically this is all about the parts of the bony pubis, or the of the bone called pubis. And this foramen, this huge foramen, basically this is known as obturator foramen. Now this obturator foramen is covered by obturator membrane in the living bodies, not in the dead bodies but in the living bodies. Now in the uppermost area of this obturator foramen, it will be deficient by the obturator membrane. That means superior to this obturator membrane, obturator foramen, the obturator membrane will be missing out. And obturator membrane, when the obturator membrane is deficient in the region of the superior aspect of this obturator foramen, that time it's going to lead to the formation of the obturator canal, which will lead to the passage of the obturator nerve and obturator vein and obturator artery. So that means from here on, from this location, there will be the passage of the obturator nerve, obturator artery, and obturator vein. Okay, so basically this is all about the parts and the attachments and relations of the pubic of the hip joint, of the hip bone. Another thing that I have missed out is that the relation of this istiopubic ramus, it will be related to internal pudental vessels and a deep nerve of the penis in case of the male, and deep nerve of clitoris in case of the female. So this is all about the parts, attachments, relations of the hip bone. Hope you have liked the video, and I hope that this video has cleared almost all your doubts regarding the hip bone. Now if you have liked the video, if this video has come to you good, then do not forget to be subscribed to our channel, and also hit that bell icon below as well to always remain updated and always be with our channel. Thank you. This is Joy signing off from this video.